If you're over 60, your heart may be getting weaker and you might not even realize it. Most people think heart problems always begin with chest pain, but in seniors, that's often not true. In fact, many early warning signs of a weakening heart look harmless at first: feeling tired more often, getting short of breath during simple activities, swollen ankles at the end of the day, small changes that are easy to blame on age. That's why so many older adults miss the early stages of heart weakness. They wait, they adapt, they ignore the signals, until one day, the problem becomes serious. In this video, I'm going to walk you through 7 warning signs that may mean your heart is getting weaker after 60. These are signs doctors see again and again, but many seniors never connect them to their heart. This is not about fear. It's about recognizing the signs early, while there's still time to act. Let's start with the first warning sign that almost everyone ignores. Before we look at the warning signs, it's important to understand why heart weakness is so often missed after 60. As we age, changes in the body happen slowly. The heart muscle becomes less flexible. Blood vessels stiffen. The heart doesn't relax and fill as easily as it once did. This means it has to work harder just to deliver the same amount of blood. At the same time, many seniors become less physically active. Daily routines shrink. Activities that once felt normal are quietly avoided. Because of this, early heart symptoms don't always stand out. Another reason these signs are missed is because they don't look dramatic. There's often no sharp chest pain, no sudden collapse. Instead, the signs appear gradually small changes that feel easy to ignore. Feeling tired more often, needing to rest after simple tasks, getting slightly out of breath climbing stairs. Most people assume these changes are just part of getting older, but that assumption can be dangerous. A weakening heart doesn't always announce itself loudly. It whispers first, and if those whispers are ignored long enough, they can turn into serious heart failure, hospitalization, or sudden loss of independence. Another major factor is overlapping conditions. Many seniors have arthritis, diabetes, lung problems, or balance issues. Symptoms from these conditions can mask heart-related problems. For example, shortness of breath may be blamed on age or weight. Swelling in the legs may be blamed on standing too long. Fatigue may be blamed on poor sleep. Even medications can blur the picture. Some common drugs affect blood pressure, fluid balance, and heart rhythm. When symptoms appear, people often blame the medication or the condition it's treating instead of considering the heart itself. And finally, there's the emotional factor. Many seniors don't want to make a fuss. They don't want to complain. They don't want to feel like a burden. So they minimize symptoms when talking to family or doctors. All of this creates a perfect storm where early warning signs are missed. That's why recognizing these signs early is so important. The earlier heart weakness is identified, the more options there are to slow progression, improve quality of life, and avoid emergencies. Now that you understand why heart problems are often overlooked after 60, let's move on to the first warning sign, one that nearly every senior experiences, but very few recognize as a heart signal. The first warning sign of a weakening heart after 60 is persistent fatigue that doesn't make sense. This is not the kind of tiredness you feel after a busy day. And it's not the normal fatigue that improves with rest or sleep. This is a deep, lingering exhaustion. You wake up tired. Simple tasks feel harder than they used to. Activities you once did without thinking now leave you drained. Many seniors say things like, "I just don't have the energy I used to." And they're often told, "That's normal at your age." But when fatigue comes from the heart, there's a specific reason. A weakened heart doesn't pump blood as efficiently. That means less oxygen reaches your muscles, organs, and brain. When your tissues don't get enough oxygen, they fatigue quickly. Your body tries to compensate by slowing you down. You may start sitting more, taking more breaks, avoiding physical activity without consciously realizing it. At first, this feels manageable. But over time, the fatigue becomes limiting. You may notice that light housework leaves you tired. Walking short distances feels exhausting. Even holding a conversation while standing can feel draining. Another important clue is fatigue that gets worse with activity but improves only slightly with rest. Unlike normal tiredness, sleep doesn't fully restore your energy. Some people also notice mental fatigue, trouble concentrating, feeling foggy or mentally slow. This happens because the brain is also receiving less oxygen-rich blood. Fatigue from heart weakness is often misattributed to aging, poor sleep, depression, anemia, or medication side effects. While those conditions can cause fatigue, heart-related fatigue is often overlooked. One key warning sign is progression. If your energy level has steadily declined over months, not suddenly, but gradually, that's a signal worth paying attention to. Another red flag is when fatigue limits your independence. When you start needing help for tasks you used to do alone. Fatigue may seem harmless, but in seniors, it can be one of the earliest and most important warning signs that the heart is struggling. Now, let's move on to the second warning sign, one that often appears alongside fatigue and is even more commonly dismissed. The second warning sign that your heart may be getting weaker after 60 is shortness of breath during activities that used to feel easy. This doesn't usually start as dramatic breathlessness. Instead, it's subtle. You notice you're breathing harder when walking uphill. Climbing stairs leaves you slightly winded. You need to pause during simple chores to catch your breath. Many seniors assume this is due to age, being out of shape, or weight gain. But when shortness of breath comes from the heart, there's an important reason behind it. A weakened heart struggles to pump blood efficiently. When blood backs up in the lungs, fluid can accumulate in the tiny air sacs responsible for oxygen exchange. This makes breathing feel more difficult, even during mild activity. At first, the body compensates. You slow down. You avoid exertion. You unconsciously adapt your routine. Over time, the shortness of breath becomes more noticeable. You may find yourself stopping more often when walking. You may avoid stairs entirely. You may prefer sitting instead of standing. Another important clue is breathlessness when lying flat. Some seniors notice they feel uncomfortable breathing when lying on their back and need extra pillows at night. This can be an early sign that fluid is shifting into the lungs when the body is horizontal. Shortness of breath related to heart weakness is often mistaken for lung problems, allergies, or simply poor fitness. But here's the key difference. Heart-related breathlessness tends to worsen gradually and consistently over time. It doesn't come and go randomly, and it often appears together with fatigue or swelling in the legs. Ignoring this sign can be dangerous. As heart weakness progresses, breathing becomes more difficult even at rest. This can lead to emergency situations that require hospitalization. Recognizing shortness of breath early allows doctors to identify heart issues before they become severe. Now let's move on to the third warning sign, one that many seniors notice at the end of the day, but rarely connect to their heart. The third warning sign that your heart may be getting weaker after 60 is swelling in the feet, ankles, or lower legs. This is something many seniors notice, especially toward the end of the day. Shoes feel tighter. Socks leave deep marks. Ankles look puffy or swollen. Most people assume this swelling comes from standing too long, poor circulation, or simply aging. But when the heart is weakened, swelling often has a very specific cause. A healthy heart pumps blood forward efficiently. When the heart becomes weaker, blood begins to back up in the veins. This increases pressure in the blood vessels, causing fluid to leak out into surrounding tissues, especially in the legs and feet, where gravity pulls fluid downward. This type of swelling is often symmetrical, affecting both legs. Another key clue is timing. Swelling from heart weakness often worsens as the day goes on and improves overnight when you're lying down. In the morning, your legs may look normal. By evening, the swelling becomes noticeable. Some seniors also notice their weight fluctuating unexpectedly. A sudden increase of a few pounds over a short period can be due to fluid retention, not fat gain. Swelling caused by heart weakness may feel tight or uncomfortable, but it's usually not painful. Because swelling is common in older adults, it's often dismissed. But persistent or worsening swelling should never be ignored. It's especially concerning when swelling appears together with fatigue or shortness of breath. Another important warning sign is swelling that doesn't improve with elevation or rest. If raising your legs no longer reduces the swelling, it may indicate that the heart is struggling more significantly. Left untreated, fluid buildup can continue to worsen, leading to complications that affect not only the legs, but also the lungs and other organs. The good news is that swelling related to heart weakness can often be managed when caught early. Now let's move on to the fourth warning sign, one that increases the risk of falls and injuries in seniors. The fourth warning sign that your heart may be getting weaker after 60 is frequent dizziness, lightheadedness, or problems with balance. Many seniors experience occasional dizziness, especially when standing up too quickly. That can be normal. But when dizziness becomes frequent or unpredictable, it deserves attention. A weakening heart may not pump enough blood to the brain, particularly during position changes like standing or walking. When blood flow drops even briefly, the brain reacts with lightheadedness or a spinning sensation. Some people describe it as feeling faint. Others say they feel unsteady or off balance. Some experience brief moments where the room seems to tilt. These episodes increase the risk of falls, one of the most serious threats to independence in older adults. Another important factor is blood pressure changes. When the heart struggles, it may not adjust blood pressure quickly enough when you stand. This sudden drop, known as orthostatic hypotension, can cause dizziness or near fainting. Dizziness related to heart weakness is often blamed on inner ear problems, dehydration, medications, or low blood sugar. While those causes are possible, heart-related dizziness tends to appear alongside other signs: fatigue, shortness of breath, or leg swelling. Another red flag is dizziness during mild activity. If you feel lightheaded while walking slowly, standing in the kitchen, or doing light chores, it may indicate your heart isn't delivering enough oxygen-rich blood. Balance problems can also worsen gradually. You may find yourself holding onto furniture, walking more cautiously, avoiding uneven surfaces. These adaptations happen quietly but signal a deeper issue. Ignoring dizziness can be dangerous. Falls can lead to fractures, hospitalizations, and long recovery periods that permanently reduce mobility. Identifying the cause early allows doctors to address heart-related issues before they result in serious injury. Now let's move on to the fifth warning sign, one that many people feel but struggle to describe. The fifth warning sign that your heart may be getting weaker after 60 is changes in your heart rhythm. Many seniors describe this as a fluttering sensation, pounding, racing, or feeling like the heart skips a beat. Sometimes it comes suddenly. Sometimes it happens at rest. Sometimes it appears during mild activity or emotional stress. A weakening heart can disrupt the heart's electrical system. When this happens, the rhythm becomes irregular, too fast, or occasionally too slow. These rhythm changes reduce how efficiently the heart pumps blood. Even brief episodes can decrease blood flow to the brain and body, worsening fatigue, dizziness, or shortness of breath. Some people feel these changes clearly. Others don't notice them at all and only discover the problem during a routine checkup. Heart rhythm problems are often dismissed as anxiety, stress, or caffeine sensitivity. But in older adults, new or worsening rhythm changes should never be ignored. Another important clue is palpitations that occur with other symptoms. If you notice heart racing along with weakness, breathlessness, chest discomfort, or lightheadedness, it may indicate that the heart is under strain. Over time, untreated rhythm problems can weaken the heart further and increase the risk of stroke or heart failure. The good news is that many rhythm issues can be detected easily with basic tests and managed effectively when addressed early. Now, let's move on to the sixth warning sign, one that often appears at night and disrupts sleep. The sixth warning sign that your heart may be getting weaker after 60 often shows up at night, when everything feels quiet and still. It's a persistent cough, a feeling of chest tightness, or difficulty breathing when lying flat. Many seniors notice they can't sleep comfortably on their back anymore. They need extra pillows to breathe easier. Some wake up suddenly at night feeling short of breath and needing to sit up to catch their breath. This is not just a sleep issue. When the heart is weak, fluid can build up in the lungs. Lying flat allows that fluid to shift, making breathing more difficult. This triggers coughing, wheezing, or a sensation of air hunger. Because it happens at night, many people blame allergies, asthma, acid reflux, or dry air. But heart-related nighttime breathing problems often come with other signs: swelling in the legs, fatigue during the day, or shortness of breath with activity. Another key warning sign is progression. At first, you may only need one extra pillow. Over time, you may need 2 or 3. Eventually, sleeping flat may feel impossible. These symptoms are important because they often indicate that the heart is struggling to manage fluid effectively. Ignoring nighttime breathing problems can allow heart weakness to worsen quietly. The earlier these signs are recognized, the more options there are to reduce fluid buildup and improve comfort and safety. Now, let's move on to the seventh and final warning sign, one that affects daily life and independence. The seventh and final warning sign that your heart may be getting weaker after 60 is a gradual loss of ability to do everyday activities. This is often the sign seniors notice last because it happens slowly. Tasks that once felt routine start to feel difficult. Walking longer distances becomes tiring. Climbing stairs requires frequent breaks. Standing for a few minutes feels uncomfortable. Many people adapt without realizing it. They sit more often. They avoid outings. They ask for help with chores they once handled easily. This decline is often blamed on aging, arthritis, or lack of fitness. But when heart weakness is the cause, the underlying issue is reduced blood flow. A weakened heart can't deliver enough oxygen and nutrients to muscles and organs. As a result, endurance drops, strength fades, recovery takes longer. One important clue is loss of independence. If you find yourself planning your day around energy limits, avoiding activities you enjoy, or feeling anxious about overexertion, it may be a sign that your heart is struggling. Another warning sign is when physical decline accelerates. If your ability to function has noticeably worsened over months, not years, that's a signal worth paying attention to. Loss of daily function affects quality of life and increases the risk of isolation, falls, and depression. The good news is that recognizing this decline early can help slow progression and preserve independence. Now that we've covered all 7 warning signs, let's talk about what to do next and how to take action before these symptoms become serious. If you recognize one or more of these warning signs, the most important thing to remember is this: don't ignore them and don't panic. Heart weakness doesn't mean the damage is already done. It means your body is giving you a chance to act. The first step is awareness. Pay attention to changes that persist or worsen over time, especially if symptoms appear together: fatigue, shortness of breath, swelling, or dizziness. The second step is communication. When you see your doctor, be specific. Instead of saying, "I feel older," explain exactly what has changed. For example, "I get tired walking short distances. I feel breathless climbing stairs. My ankles swell by the end of the day." Clear descriptions help doctors connect the dots. The third step is basic evaluation. Simple tests can reveal a lot: blood pressure checks, blood tests, an electrocardiogram, sometimes an echocardiogram to see how well the heart pumps. These tests are routine and non-invasive, but they can detect problems early. Another important step is reviewing medications. Some drugs can affect fluid balance, blood pressure, or heart rhythm, especially in older adults. Never stop medications on your own, but ask whether any could be contributing to your symptoms. Lifestyle adjustments also matter. Gentle activity, appropriate rest, and managing salt and fluid intake can reduce strain on the heart when guided by a healthcare professional. Most importantly, act early. Waiting until symptoms become severe limits options. Early action gives you more choices and better outcomes. Now let's bring everything together with a final summary and message. If you're over 60, your heart may not fail suddenly. It often gives quiet warnings first: fatigue that doesn't improve, shortness of breath during simple activities, swelling in the legs, dizziness or balance problems, changes in heart rhythm, nighttime breathing difficulties, a gradual loss of daily function. Each of these signs matters on its own. Together, they tell a powerful story. A weakening heart is not something to ignore, but it's also not something to fear. When caught early, there are many ways to slow progression and protect your quality of life. Listen to your body, take changes seriously, and speak up when something doesn't feel right. If this information was helpful, consider sharing it with someone you care about. It could help them recognize signs they've been overlooking. Your heart has worked hard for decades. Paying attention now is one of the best ways to protect your future. Take care and stay informed.